Obviously, if reflexes were the only thing that were controlling our movements, we would be chaotically running around like a bunch of wild animals. So that's clearly not the case. So how might we start to bring order to this level of chaos, or reflexes, if you will? Well, this brings up the hierarchical model of motor control. So an English physician named Hierarchical came around and said, well, I think that the central nervous system is organized kind of like a company with higher, middle, and lower level departments. So Jackson believed that the central nervous system had a higher level department, the cerebral cortex, a middle level department, the hindbrain, the midbrain, the brainstem, cerebellum, and then lower level department called the spinal cord. And each level of the organization, if you will, had the ability to modulate, inhibit, or control lower level areas of the central nervous system. So in this example here, we could look at the cerebral cortex having the ability to modulate any reflexes that lived in the midbrain region. And likewise, the midbrain region could modulate lower level reflexes that lived at the spinal cord. So if we go back to our example with the hot cup of coffee sitting on a couch, the immediate response to holding a hot cup of coffee technically is to withdraw. And that withdrawal reflex lives at the spinal cord level. However, because we're trying to keep the baby safe, our cerebral cortex kicks in and says, well, wait a minute, we need to now alter the sensitivity of the temperature receptors and bear that pain just a little bit longer so that we can keep the baby safe. So this hierarchical model gives us this level of hierarchical control, if you will, just like we see in a Fortune 500 company. To take the hierarchical model a bit deeper, we had Rudolf Magnus confirm some of Jackson's suspicions, because Magnus was very interested in studying reflexes at various regions of the central nervous system. So he was interested in looking at, okay, what reflexes belong to what anatomical region within the central nervous system. And one of his profound observations was that after a stroke or after some type of cerebral cortex pathology, lower level reflexes were re-emerging clinically. So like the tonic labyrinthian reflex, for example, post-stroke was just as exaggerated as it was in the first month after birth. So if we go back and take a look at this hierarchical organization, we know that there's higher centers, there's middle centers, and there's lower centers. But for the sake of simplicity, we'll just look at the higher and the lower centers. We know that the tonic labyrinthian reflex lives at the lower centers of the central nervous system. And from Hewlings-Jackson's experiments, we seem to think that the higher centers can actually control or modulate the lower centers by either increasing or decreasing their manifestation by means of modulating the action potential threshold of the reflex. So Magnus was like, well, wait a minute, Jackson might be onto something here, because after the higher center is insulted, there seems to be an increase in these primitive reflexes. So it just makes logical sense to think, all right, well, if the higher centers are able to control the lower centers in normal function, then after the higher centers are affected and there's less inhibitory or descending modulation from these higher centers, we have this increase in primitive reflexes, which by reverse engineering helps to confirm some of Hewlings-Jackson's suspicion of this hierarchical model where higher centers can control lower centers. Now you might be thinking to yourself, well, Mez, I don't deal with cortical pathology. I don't deal with neurologically involved patients. I'm in orthopedics and sports medicine. Well, here's the fascinating thing. from both my observations and things that I've read from Czech neurologist Vladimir Janda and Carl Levin, is there seems to be similar patterns of primitive reflexes reemerging, although to a way lesser extent, in chronic orthopedic conditions such as lower back pain. We're actually seeing the tonic labyrinthian reflex actually presenting itself with some of the assessments and treatments that we're incorporating into low back pain, neck pain. I can visualize several of my patients that I've worked with in orthopedic clinics where in the moment of treatment, I was actually remembering my hemiplegic patients and their patterns of movement. When I was working with someone with back pain, they were laying on their back, their neck was in extension. I was trying to facilitate trunk flexors. And as soon as I corrected the neck extension pattern, it was a lot easier for them to do the exercise or to tap into the flexors. And then I started realizing, well, wait a minute, if I take the patient out of the supine position, place them in sideline, and bias their neck and their whole torso into a little bit more flexion, just like I did when I was working with bed mobility with my hemiplegic patients, now all of a sudden we're getting the response that we're looking for, or the exercise that we're trying to do is a lot easier. So this concept of linking neurological principles to orthopedic issues and what we're seeing in an orthopedic clinic is a very interesting paradigm shift for me when I transitioned from treating neurologically involved patients coming back to the orthopedic clinic. The hierarchical model just started screaming out at me. And I continue to really investigate this a bit more, and we actually start to incorporate a lot of this in the checklist items. Some of you may know the hierarchical model as the neurodevelopmental model, and those two words can be interchangeable in regards to motor control. But there's a concept in this model called corticalization, or in other words, the central nervous system matures from the bottom up, starting at the spinal cord and the brainstem level. That matures first, then we mature the midbrain, then the cerebral cortex finally matures. And this process of corticalization basically states that our ability to control these primitive reflexes correlates to our ability to motorically develop as humans and attain certain postures as each successive area of the central nervous system matures. So we're going to go back to the tonic labyrinthian reflex. Knowing that that reflex exists at the spinal cord level, it's not until we can fully control the tonic labyrinthian reflex at the first few months of life where we are then able to attain the quadruped position. Because if we're not able to control the tonic labyrinthian reflex, in other words, if we cannot take our head and neck out of an extended position, we then cannot take our trunk or our spine out of an extended position, which makes it extremely difficult to roll from supine to prone. So only when the midbrain starts to mature, and only when we can control the tonic labyrinthian reflex, can baby actually control the head and neck, bring it from an extended position to a flexed position, tap into the trunk flexors, and effectively roll into the prone position, and then start to wrestle with achieving the quadruped position. So the hierarchical model, or the neurodevelopmental model, basically links our ability to control reflexes with our ability to attain certain postures, which then allows us to attain successive levels of motor development and therefore locomotion at the end of the first year or two of our life. So clinically, to bring this to pragmatic application, we have various people in our past, Dr. Cabot, Maggie Knott, and many others, have utilized this neurodevelopmental or this hierarchical model as a reference point or as a framework to systematically screen, assess, or just simply challenge different postures, balance, exercises by using these lower level postures, bringing them to higher level postures. Supine, prone, side lying, prone on elbows, side sit on elbow, side sit on hand, quadruped, various forms of kneeling, standing. And we can use these postures in these positions as a way of either progressing or regressing humans or our clients through exercise or just giving them a movement experience. Now, some of you are familiar with the functional movement systems. Some of you are familiar with the dynamic neuromuscular stabilization system, DNS. Some of you are familiar with NDT, neurodevelopmental treatment. What I'm getting at here is we can utilize the hierarchical model as a framework, as a checklist item, if you will, by using the milestones of development and how a baby achieves their ability to locomote on 2 feet. We can utilize that to help give someone a positive experience with us. For if they can't do something, we identify what posture that is, and we say, okay, how can we take that step backwards and bring them to a easier posture to control? A quick example here of me taking a client from a rolling exercise, and I'm not particularly interested in discussing the logistics about rolling, but I'm more interested right now in the principle or the concept. So one of my clients was very challenged by getting some level of core endurance. He was a martial artist and he was having a hard time with kicking and hip mobility. And we found that one of the biggest limitations was his ability to tap into his trunk flexors. And he had a very hard time rolling from supine to prone. And I saw a mild manifestation of the tonic labyrinthian reflex. So what we did was we took him through a progression of core drills and we programmed that into his strength and conditioning program. And all I thought about was this progression. How do we start from our back? And then how do we come to a quadruped position, or in this example, I had him in a high plank position because he was young and he wanted to feel like he was getting a workout. He wanted to feel his abs. This is a martial artist. We couldn't just be rolling on the ground the whole time. But in this way, I was able to give the client what he wanted, but I also was able to give the client what he needed at the same time while still incorporating the beliefs that we talked about in the very beginning, staying positive, doing what he could do, and then trickling in some of the weak points that we found by finding the weakest link within this progression of postures. Now let's discuss a big limitation from the hierarchical model. So the hierarchical model gave us this understanding that these higher centers can control and modulate these quote-unquote primitive and immature reflexes in the lower centers. But let's take, for example, stepping on a nail and the flexor withdrawal response or the cross extension reflex. I have to say, every time I visualize this type of situation, all I can think of is the wet bandit Marvin from Home Alone stepping on the nail in the basement and screaming. But in that example, what we see is a lower level reflex demonstrating its dominance on these quote-unquote higher centers, which demonstrates the fact that the hierarchical model doesn't do a very good job at explaining this bottom-up control in terms of motor control. It does give us some insights in terms of this top-down control, but we shouldn't be quick to judge or shouldn't be quick to assume that just because these lower level reflexes are primitive, that they don't have the ability to exert their dominance on these higher centers. And I think that's one of the biggest limitations of the hierarchical model, which, again, other models of motor control will actually help fill in this gap. Now let's take a step back and take a look at the reflex model and the hierarchical model. What insights can we glean from both models? Well, the reflex model tells us that reflexes help automate complex motor behavior. So for a very complex system to be simplified or automated in some way is very helpful. And Dr. Charles Sherrington helped us realize that reflexes was a huge piece of that puzzle. The hierarchical model shows us that there's some type of top-down organization that helps keep reflexes in check, if you will. And this therefore allows for both motor and postural development as seen through the neurodevelopmental model. And the limitations. What limitations do both models have? Well, we saw that the reflex model explains bottom-up control pretty well, but it doesn't really explain the top-down control. Remember the example with the hot cup of coffee on the couch with a baby. The reflex of withdrawing from that hot cup of coffee is modulated because we don't want the baby to burn. So the reflex model didn't explain that. The hierarchical model, that does a very good job at explaining that because it explains this top-down control or this higher center modulation on lower centers, but it doesn't explain bottom-up control very well. So now we can see that one model complements the other model by blending their strengths and weaknesses. So instead of debating about which model is better, we can see how each model can synergistically give us an answer that we could not get from just using one model or the other. So when we go back to the inquiries of motor control, how does the central nervous system organize all these joints and muscles into coordinated movement? Well, the reflex model tells us that reflexes help to automate by linking some of these joints and muscles into an automatic response. The hierarchical model tells us that higher centers of the central nervous system can keep the lower level reflexes in check so that we can use them when we need them and inhibit them when we don't need them. How is sensory information from our environment and our bodies used to select and control movement? Well, again, the reflex model is utilizing the sensory afferents coming from the periphery and creating this automatic response through that sensory input. And the hierarchical model is saying, well, this sensory information is coming in to the spinal cord, up into the midbrain, up to the cerebral cortex. It is being processed, and depending on the situation, again, these higher centers can inhibit a lower center reflex. Again, the example with a hot cup of coffee sitting on the couch with a baby. The sensory information of knowing there's a baby on your lap is used. It's paired with this temperature receptor input, ouch, hot. And then the central nervous system makes a decision and selects and controls the movement based on that information and based on weighing the pros and cons. All that happens in milliseconds, which I find fascinating. And then number 3 and 4, how does the body as a mechanical entity influence motor control? And how do the initial conditions of a task and environment influence motor control processes? I do not think that the reflex model and the hierarchical model answers these questions very well, but the next few models of motor control, I think, do a good job at giving us some insights into these questions.